Good evening. How many of you know someone or have been themselves admitted into a hospital for an invasive procedure requiring them to be in the OR? Well, I know I have. Now, my second question comes from this scenario. Imagine you're lying on your back in the OR and your anesthesiologist walks in. The whole team has gathered up, but you realize one thing so far: nobody's wearing a mask and nobody's wearing gloves. Now, what would your reaction be? Now, I know I'd jump out of bed because this screams nothing but infection and could possibly result in me dying. My name is Jenny Martins Francois. I am a nursing student at Gilman College of Nursing, and I'm here today to share with you why masks work. Let's take a trip back to pre-COVID-19 era. I remember working as a unit clerk at a very prominent teaching university hospital in New York City. And one part of my job description was whenever we have a patient on the floor that is on contact precaution, battling some sort of respiratory infectious disease, one part of my job description was to make sure that any visitor walking into that room is aware that the patient is on contact precaution, and consequently offer them, some sort of personal protective equipment, like a mask or a gown, most likely a mask. One thing that strikes me is nobody has ever debated that. Nobody objected to that because it is an established fact that we are trying to protect you. The hospital let you understand that we are trying to protect you. This patient is sick. However, wearing a mask or wearing your gown would eventually stop the spreading. According to Dr. Milan Hahn, a professor of medicine in the critical care and pulmonary subdivision in the University of Michigan, respiratory infectious diseases are transmitted from person to person via respiratory droplets that are released when someone speaks, talks. Now, when the droplets are inhaled into the lungs of a person nearby, he or she can contract the disease. And this is wearing a mask serves as a physical barrier, trapping those droplets, stopping them from being released into the air. On July 14, 2020, an issue in the Journal of the American Medical Association, JAMA, talked about a case study showing how universal mask wearing policy in a Boston hospital reduced the transmission of COVID-19 cases. Another study in the CDC Morbidity and Mortality Weekly Report show how wearing a mask prevented two Missouri hairstylists from spreading the virus to their clients. Both stylists continued to work. However, they wore a mask around the clock. 98% of their customers also wore a mask. Before being diagnosed, the stylist saw 139 customers, and none developed any symptoms of the virus during the follow-up period. None of their secondary contacts developed symptoms either. Additionally, of the 67 customers who agreed to be tested, none were positive for the virus. We are in the middle of a pandemic, and according to the CDC, COVID-19 has killed so far 533,057 people. These current times changed the lives of many of us, and not wearing a mask puts so many of us at risk. Mask works. It stopped the spreading of respiratory diseases. A surgeon wears a mask because it works. Despite scientific evidence supporting mask effectiveness, many Americans object to it. Some will tell you they're uncomfortable. Well, my advice to you is this. I've worn some uncomfortable masks also. However, I kept looking until I found one that fit and, up to my liking. So I advise you do the same. Other people will mention the carbon monoxide buildup while wearing a mask. No scientific evidence so far has supported this claim. Let's think about the healthcare workers here for a minute, our frontline workers. Let's think about our surgeons, our physicians, our nurses who are right now wearing an N95 mask. Well, earlier this year when COVID just hit, they were wearing these masks around the clock for hours. None of them has reported any carbon monoxide buildup. And thirdly, we'll have people will tell you that it's my civil right to refuse to wear the mask. Absolutely. I will not debate that because it is your civil right not to wear the mask. However, how many times have we abridged civil rights to avoid chaos in society? For example, free speech is a civil right. However, it is very well established in society that you cannot walk into a theater and scream hellfire or sitting on an airplane and yell bomb. However, we have free speech. A second notion is the no shirt, no shoes, no service. The vast majority of society have accepted that. However, one is entitled not to wear a shirt or not to wear shoes. However, if you walk into a restaurant, no shirt on or without any shoes, you will not get service. Oh, as I stated, we know as a fact that masks work. A lot of people have died in this pandemic. It is our public responsibility. It is essential to the public what happens to us. Wearing a mask is protecting each other. It's not about me, it's not about you, it's about us as a community. Our duty as a community is to protect each other. To all the healthcare workers who care for us with such professionalism, mask wearing troopers, we thank you and hope that more of us can meet your mask wearing standards. Thank you.